The South African National AIDS Council Civil Society Forum is set to convene its Lekgotla from tomorrow in Ekurhuleni, Gauteng. The gathering will bring together civil society, government and health sector stakeholders to strengthen South Africa's response to HIV, TB and STIs. A key priority will be working to ensure that civil society remains a key player in advancing national health priorities. SANAC CSF Chair Nduku joins us for more. A very good evening to you. Thank you so much for your time. As you prepare to host your Lekgotla, the timing, of course, is one which the US has withdrawn crucial funding to a number of projects. Talk to us about what you are setting out to do and achieve within the Lekgotla.
A very good evening to you and your viewers and the listenership. Obviously, the SANAC Civil Society Forum is aligned to an AIDS global strategy to end AIDS as a public health threat by 2030. So the Lekgotla will crystallize our approach as civil society to respond to this ambitious goal. And the primary goal of the CSF Lekgotla, amongst others, is to finalize the strategy, review and refine the SANAC CSF strategy to ensure alignment with the National Strategy Plan on HIV, TB and STIs. Secondly, it would be to strengthen governance and coordination with the aim of improving accountability across national, provincial, district and local levels. And thirdly, it would be to enhance the civil society role, policy and advocacy through reinforcing the CSF ability to influence national health policies, advocate for human rights, and hold stakeholders accountable for their commitments. And the fourth aspect be to ensure inclusivity and representation through engagement of diverse stakeholders, key and vulnerable population groups, to ensure that the national response is driven in an equitable way, and ensure that we secure the sustainable resourcing of the NSP through development of the strategies for development of a domestic resource and partnership to sustain HIV, TB and STIs interventions amid all the shifts that we have realized in terms of the donor priorities. And lastly, is to improve monitoring and evaluation through introduction of a robust framework to track progress, measure impact, and ensure that commitments made during the Lekgotla translate into action.
As you speak about, re-looking at the strategy and, looking at the goals that you want to achieve, what impact would you say the funding from the US has had on the various entities working towards curbing the numbers and assisting those infected or affected by HIV and TB?
It has had a significant impact. Hence, now we are actually looking at the Lekgotla, looking at strengthening collaboration between civil society, government, and other health sector role players, including the private sector in the country. And we want to ensure that we put more efforts in the mobilization of domestic resourcing of the public health interventions within countries in a more sustainable way, because we have learned the hard lessons that the over-reliance on the donor, it actually makes us vulnerable, because when the donor priorities are shifting, it does tend to have a negative impact. So it becomes imperative that our emphasis should be on domestic resourcing, but also engaging the private sector and the private sector role in a more robust way.
As you prepare for the Lekgotla, what would you say are some of the biggest challenges you're facing on the back of the lack of funds that have been withdrawn, and of course the real goals when it comes to curbing HIV?
One of the key challenges is the issue of strengthening the collaboration. Hence, we actually looking at bringing community priorities to the table and ensure that all the 18 sectors and also the people living with HIV, traditional leaders, faith-based organizations, the youth, we all make sure that they are marshaled towards one direction to ensure that the diverse perspectives are represented and their lived experiences are actually tapped on to shape the priorities of the HIV response at a local level, district, provincial, and national levels. But one of the key aspects is to ensure that we hold everyone accountable, especially those who are decision makers, by engaging local, provincial, and national leaders and make sure that we continue to have engagement which seek to ensure that the government and the health sector are hearing directly from communities that are affected, and in a manner that creates a direct feedback loop where community identified issues lead concrete commitments for policymakers.
Would you say that there is some sense of willingness and encouragement as you engage different stakeholders in really just making up for some of the funding that has been lost and some of the organizations that have closed down? And of course, it impacts livelihoods as well as actual lives and health. What would you say is the response that you're getting so far?
The response that we are getting, it signals positivity, both from the side of the government as well as the private sector. And we are expecting various ministers to make their own inputs during the Lekgotla, but also the private sector is also expected to make their inputs, which will make a significant contribution in enriching the discussions during the 3-day engagement through the Lekgotla. But one of the critical aspects for us is that we don't regard the challenges as a setback, but we regard the challenges as an opportunity to turn them into solutions. So this engagement, it is not just about talking, but it is about co-creating action plans by working together as civil society, government, as well as this private sector to define the short, medium, and long-term interventions that will ensure that services are continuously reaching the people who are in need at the most.
Absolutely, very well. Thank you so much for your time. We're going to have to leave it there. Of course, speaking to the South African National AIDS Council Civil Society Forum's Chair, Nduku, as they prepare for their Lekgotla.